Welcome to the Biohacker podcast. I'm Azra Aligic, your host and founder of Biohacker. I'm a longevity and integrative nutrition health coach, a health and wellness journalist, writer, corporate consultant, and a biohacking advocate. Are you worried about getting old, wondering whether the biological demise of your body is just something that you have to accept? Well, think again. We don't have to get old the way we used to, because now you can biohack your body to a younger you. Biohacker is a space where we can explore ways to optimize our health to live well longer. Whether it's through nutrition, exercise, cryotherapy, supplementation, technology, and more, I'll be bringing you information and interviews on understanding how biohacks can help you prevent disease, slow down, or even reverse the aging process by taking control of your unique bio-individuality. Want to know more? Let's start turning back the clock. Have you ever suffered from depression, anxiety, or another mental health illness? Mental health illnesses are on the rise. Based on survey results from the National Study of Mental Health and Wellbeing of Australians aged 16 to 85, an estimated 8.6 million have experienced a mental disorder at some time in their life. That's 44% of the population, or 2 in every 5 Australians. 4.2 million have experienced a mental disorder in the previous 12 months. Anxiety disorders, such as social phobia, are the most common type of disorder, affecting 1 in 6 Australians, followed by affective disorders and substance use disorders, such as alcohol dependence. Depression is one of the leading causes of disability. Suicide is the 4th leading cause of death among 15 to 29-year-olds, and people with severe mental health conditions die prematurely, as much as 2 decades early, due to preventable physical conditions. There are many different types of mental illness. Some of the main groups of mental health disorders are mood disorders, such as depression or bipolar disorder, anxiety disorders, personality disorders, psychotic disorders, such as schizophrenia, eating disorders, trauma-related disorders such as post-traumatic stress disorder, and substance abuse disorders. So what are the cause of mental health disorders? There's genetic factors. Having a close family member with a mental illness can increase the chance that you might get a mental illness. However, just because one family member has a mental illness doesn't mean that others will. Drug and alcohol abuse. Illicit drug use can trigger a manic episode, like bipolar disorder, or an episode of psychosis. Drugs such as cocaine, marijuana, and amphetamines can cause paranoia. Other biological factors, some medical conditions or hormonal changes can also cause mental health problems. Then there's early life environment. Negative childhood experiences can increase the risk of some mental illnesses. Examples of negative childhood experiences are abuse or neglect. In adulthood, traumatic life events or ongoing stress can increase the risk of mental illness. Issues such as social isolation, domestic violence, relationship breakdown, financial or work problems can impact our mental health. Traumatic experiences such as living in a war zone can increase the risk of post-traumatic stress disorder. And then there's personality factors. Some traits such as perfectionism or low self-esteem can increase the risk of depression or anxiety. And there's also growing research linking gut health to mental health. This is the topic of my conversation today with Dr Sadasivan. Dr Sadasivan trained in psychiatry in the United Kingdom, Mercy Deanery Rotational Training Scheme, before obtaining membership of the Royal College of Psychiatrists in the UK. She then moved to Australia, where she completed her fellowship in psychiatry with the Royal Australian and New Zealand College of Psychiatrists. Dr Sadasivan worked in psychiatry at the Gold Coast University Hospital for 8 years before moving to private practice. She was an associate professor with Bond University of Medical Sciences, where she held the position of clinical lead, in charge of medical student clinical posting and training in psychiatry until 2015. With over 20 years of clinical experience, Dr Sadasivan specialises in general adult psychiatry. She uses a holistic approach to treat conditions with a focus on the gut-brain axis. She has a special interest in the management of treatment-resistant mood disorders, anxiety disorders, and substance use-related disorders. Let's dive in. Hi, Asha. Thank you and welcome to the Biohacker podcast. I wanted to dive right in and get you to tell our listeners a little bit about yourself and your professional background, if you might.
No problem, Esther. Thank you so much for this opportunity to do the podcast with you. My name is Dr. Sadasivan. I'm a general adult psychiatrist. Just a little bit of a background about me. I grew up in India. I did my basic medical degree from India. Following that, moved to England to do my high training in psychiatry. After completing the English counterpart of the qualification here in Australia, I moved to Australia and started working with Queensland Health from 2006. In 2010, moved into private practice, and now I work purely in private. Yeah, that's a bit about me. Before we go further, I would like to just have a small disclaimer regarding this podcast. I'm a general adult psychiatrist, not a trained nutritionist or naturopath. My knowledge in nutrition is through my own personal research, and hence it's separate from my practice of psychiatry, and also from my knowledge of diet changes and its impact in the patients that I treat.
Sure. And you're stating that because we're going to have a chat today about gut health and the impact of good gut health on mental health, because there's been some growing research around that. But before we dive into that, could you please explain the concept of the gut-brain axis for our listeners and how that can impact mental health?
Sure. Well, until say late in the 90s, we really didn't know much about these little microorganisms that lived in our gut, mainly because we didn't have any technology or techniques to culture them, because a lot of them don't grow in the natural cultures that we use for growing. Say when we get a swab from an infection, we can culture those bacteria in culture dish, while most of the gut bacteria or gut pathogens or microbiome, we cannot really culture them. So it's only until when the human gene project came along, and when they figured out technology and ways of finding out how many genes and chromosomes and all that is there in human beings, that someone decided to use the same technique to assess a small sample of poo of an individual or animals. To their surprise, they found all these jungle of microorganisms living in the gut and in all other surfaces or living beings. Later on, we realized that these microscopic agents that are living in us or on us are so vital for our homeostasis or health. So the concept of gut-brain axis came from the understanding of that we have a totally different nervous system compared to our brain and spinal cord sitting in our gut. This is called the enteric nervous system. It's about 500 million or more neurons. In fact, it is more than the number of neurons that comes from our spinal cord. And then it was about trying to figure out, okay, what's the importance of this and how does this connect with our brain? They did studies to look at cutting the enteric nervous system completely off the brain. And they found that, to their amazement, that the enteric nervous system still functioned and the gut still moved and people were all right. So then they're trying to figure out, how does this enteric nervous system fit in with the rest of the nervous system in our body? And by researchers from all parts of world, they have found this gut brain axis. So literally it is an axis of our central nervous system, which is our brain, the gut, as well as the microbes that are living in us, and how it is connecting to and fro. That forms the core of gut brain axis.
Right. And so how does it impact mental health in particular?
Right. Okay, when we talk about mental health, I would like to first look at what is actually health,
Sure.
because health, to me, I feel health is like a combination of factors. It is a recipe. Just
Mhm.
like when we are making a dish, any element needs to be in the right proportion for the dish to turn out good, and it needs to taste good. Similarly, we have got all different elements of our health. When it is mixed in the right proportion, we have good health. And in that, what does the gut health contribute? It's still, it's a whole new field. There's so much new studies happening in that area. We have found that microbiome, or which is a collection of microbes, which includes not just bacteria, it includes fungi, archaea, viruses, protozoa, all these different microorganisms living in our gut. And what's their function? Scientists have found out that the microbes communicate with our brain in all different fashions. So it includes them making short chain fatty acids. These are chemicals which our body are unable to make. However, with the interaction of these microbes with the fiber or their nutrients that we provide through our diet, it makes short chain fatty acids, which are absorbed into our bloodstream and travels up to the brain. Now, that is only one way of microbes communicating with our brain. There are other ways how microbes communicate with our brain. For example, we have got our peripheral nervous system, which means that the nerves that are there in the periphery other than in our brain, which includes what is called as the autonomic nervous system, which has got these two different sides of the nervous system. One is the sympathetic nervous system, which is our alertness, our ability to motivate ourselves, but also it is our that part of the nervous system which drives the fight and flight response. While we have got another part of the autonomic nervous system called the parasympathetic nervous system, which helps us with sleep, calmness, stimulation of that, reduces our anxiety levels, and the balance between these autonomic, both sides of the nervous system are prudent for our good functioning, but the balance between them is very important. So if one of the side of the nervous system is overactive, then we suffer from conditions like depression, anxiety, stress response. While if the parasympathetic nervous system is working properly, we are able to conduct ourselves still reasonably functioning even in stressful situations. Now, the brain communicates with the gut nervous system called the enteric nervous system through the vagus nerve, which is that parasympathetic nervous system that I was talking about. Now, vagus nerve travels all the way from the brain through the diaphragm down to the stomach and into the enteric nervous system. And stimulation of this vagus nerve helps us being calm. Some of the researchers have also worked out that our vagus nerve functioning well and not having severe stress response is also important for our microbiome's viability. So the microbiome communicates with our brain, one, through the short chain fatty acids, second, through our parasympathetic nervous system. They stimulate the vagus nerve and creates this calming environment for us. Now, the third way that the microbes communicate with our brain is through hormonal. So making chemicals that then get absorbed into our bloodstream and gets traveling to the brain, affecting, brain function. Certain hormonal functions are good, whilst others are inflammatory. So I don't know whether I'm talking too much here to the question.
No. That's a really great breakdown. I think that's awesome, and it's such a complex area because when you look at gut health and the impact of gut health on mental health and the complexity of how microbiomes work as well. And you're right, there has been lots of recent research that's come out that's highlighted the importance of gut health on mental health. And indeed, there's been some research from scientists like Emma and May and others that talk about the gut microbiome's influence on mood and anxiety. And you touched on this. Could you flesh that out a little bit more? Because sometimes, I think when we're we're moody or we're having a bad day, or something like that, we don't necessarily understand the source of that mood or that emotion. And I think quite often a lot of people might not realize that it could be coming from their gut health.
It is quite early still to say that what is causing. It's like a chicken and egg situation and a vicious cycle. Certainly, majority of the neurological chronic, not just neurological, chronic illnesses are now shown to be having a direct relationship to the amount of inflammation that we have in our body. Now, when we were in medical school, if someone would have said, like, Alzheimer's is an inflammatory disease or Parkinson's is an inflammatory disease, we would, say, what are you saying? You're
Yeah.
delusional. What are you
Yeah.
talking about? But now, more and more, the researchers are finding that other than acute illnesses like, injury, chronic illnesses, almost all of them have got this inflammation as a common factor. So when it comes to depression and anxiety, now the researchers are considering these conditions as an inflammatory disease. Now, you could be exposed to traumatic childhood experiences, or you might have some of the genetic predisposition from your parents, which might be the initial trigger for depression. However, how does this depression get perpetuated? And what's the role of microbes in the perpetuation? And that's how I have reasoned it out. And that doesn't necessarily mean that's the chicken and egg situation. As I said, it could be also the fact that the maternal nutrition during the pregnancy predisposing the fetus to having these kind of symptoms. But for us at a practical level, we got to look at where could this inflammation come from. Now, my interest, I want to retract a little bit before we talk about the inflammation and anxiety disorders and impact of microbiome in my interest in gut microbiome, diet, mental health, physical health started probably in the 2015 range. I personally suffered from eczema and was on steroids, creams, all kinds of, and had a very good balance of, breakdown of good home cooked meals along with really poor diet with all the preservatives and soft drinks and you name it. It was a mix of all that.
Yeah.
So I started doing my own research and stumbled into Ayurvedic kind of treatment and diet and lifestyle. Did a course in nutrition, Ayurvedic nutrition, and I was like, wait, let me try it on myself first. I changed my diet and almost at 90%, and my eczema went away. And I was like, wow. So then again, further research into diet and nutrition, and we cannot really, I'm amazed by this divide of people, even with the best intention and want to get better. We don't really make the connection between food is information. Even
Yep.
every bit of our bite that we take of our food is that piano fingers going all along our genes, switching on and off our genes. So food as a medicine and therapy was really more and more dawning on me. So I started advising my patients, didn't expect huge results. By the time a patient comes to a psychiatrist, they would have gone to primary care, would have tried a few antidepressants or antipsychotics. By the time they come to us, they would have tried 3 or 4 different medications. So I could probably throw another set of medication to the patient, but it's not holistic. It didn't include all aspects of their life. Started looking at their diet more closely, and I realized that, there is so much we could do. So I started advising very simple diet advices, eating whole foods, avoiding processed foods. And it wasn't very complicated diet advice. I started seeing that patients are starting to get better. You know, Started understanding the link between certain type of foods and anxiety disorders. And I realized that one of my patients walked in and said, like, she would drink about 3 liters of soft drink a day, probably
Wow.
about 7 to 8 liters of dairy a week. And the patient is presenting with severe anxiety, worsening of psoriasis and OCD symptoms all the way through. And she's been on all different antidepressants. I cannot invent any more antidepressants for her. So there wasn't an element of pharmacological treatment I could have added on for her. So I said to her, see, we can look at different combination of medications, but first let's do one thing. I'll give you 6 weeks. You go, and I'm not going to make you dramatically change your diet because it's going to be hard for you to follow. But certainly, there are certain elements that I want you to try and totally avoid, and maybe add in one or two new vegetables in your week. So by the 6th week, you're having at least 10 new things. And let's look at how you go before we change your medication. And the patient was so happy. She came back and said, Doctor, I didn't tell you last time. I have been having gastroenterological problems for a while. And I have seen so many specialists, had colonoscopy and endoscopy so many times, and I haven't actually seen this change. It was wonderful, and my gut is the best that it's ever been. And slowly, over the next 3, 4 months, her skin lesions started subsiding, her mood started subsiding. So, that's really how my journey began. And now, over the last 3 years, I have been collecting diet information from my patients. So, I haven't managed to, because it's a one-man army, so I haven't managed to analyze the data. It's all sitting there in my clinic. But what I use it for is for my initial consultation to see where they are at, so that we can have some direction for future plan. And it gives me an idea of certain things that I can tweak along with, medication or other psychological treatments that we might use. So coming back to your question, the link between the gut and the brain, having said that, considered like depression and anxiety as inflammatory disorders, now where do the inflammation come from? So we have, our skin is not the largest surface area that we are in contact with the outside world. It is in fact our gut. Gut has got about 100 times the surface area of our skin. So about 70% of our immune system is sitting within our gut. Now, these gut bacteria, some good and some bad, they're all living in harmony. There isn't an issue. The problem is when there is dysbiosis, when they are in imbalance, a state of imbalance. What happens is that the mucin layer, that is the mucus layer of the intestine, also gets thinned out. Inflammation starts affecting the intestinal walls, causing leaky gut, which leads to absorption of nutrients and things in the gut that we are not supposed to get into our bloodstream, which triggers this whole cascade of inflammatory reaction, including certain cytokines like interleukin 6 and so many other cytokines, which leads to low grade inflammation. Before, we used to think that this inflammation takes years before it catches up with us, but some of the studies now is showing immediately after one meal, like 15 minutes to 30 minutes later after you have your meal, they can show a signs of low grade inflammation rising, which stays high for 3, 4 hours, then comes down, but then it goes up again by lunchtime. That's lunchtime. So this body is going through this low grade inflammation day in and day out, and eventually leading to all these conditions. Once it's fully established, it's hard to treat, but it certainly can be prevented if we are careful of looking after our microbiome.
Oh, most definitely. And as most of my listeners would be aware if they've been listening to the podcast for a while, I've had leaky gut. And it can be turned around, and you can heal your gut, and you can recover from it and gain good health again. And it's a case example, I think, of how, eating processed foods, you and I are both classic examples of that, because I was the same. As, I was brought up that way, and sure, mum cooked at home, but we quite often had takeaway, and there was soft drinks. And I think back then, there wasn't the understanding and the knowledge that we have today of the detrimental impact that a highly processed diet can have on our guts. And indeed, I think whenever you go to the doctor as well, and many medical practitioners that I've spoken to and that I study now, by their own admission, admit that when they did their medical degrees, they may have done, maybe 1 unit in nutrition in their whole medical degree. So they're not actually experts in nutrition. And yet the latest research is showing this strong connection. As you said, that food is medicine. Food are indicators to our body. They can trigger, the longevity hallmarks as well of aging, and absolutely impact our health if we're not careful. So I think that the summary and the outline that you've just provided to our listeners, I think it's a really great outline of how this impacts people. What about stress? I mean, stress is, years ago, we thought that stress was something that, it's okay, you're just stressed. It's not going to impact your health or your body in any other ways. I think you touched on it just earlier, but I'd like to do a bit of a deeper dive into how stress impacts the brain and the gut.
Okay. Again, I want to go back to what's food. To me, food is anything that we take in. So it could be what we are eating. It could also be the information that we are taking in through all our senses that forms our thoughts and emotions, right? So there is a natural way of our body eliminating what we put into our system through our mouth. So there is we go to toilet, we empty everything, all the roughage, we empty that. But how do we manage the food that we take in through our senses? Unless we have an ability to manage the stress, manage the information that is coming in, process that, and put it into the right boxes, and throw away the bits that are not useful for us, the information that's taken into our mind remains there as, an unprocessed food which is stuck in our gut. That's the parallel that I use with my patients. I believe, and this is only it's not really based on research, it's purely based on my practice, that stress has got bidirectional link with the gut. When you are in a state of stress, what happens in the brain? Our forebrain, which is the higher function, executive function, our CEO, which helps us in the day-to-day, problem solving and making the right decision, shuts down. And the hindbrain, which is more primitive, which is important for our survival, kicks in. So it is designed, evolutionary wise, it is designed to protect us. So when we were cavemen, when we come out of a cave and we see a tiger standing on the one side and a rainbow on the other side, we are expected to pay attention to the tiger and not to the rainbow so that we can save ourselves, right? So that's what this primitive nervous system, which is important for our survival, does. But unfortunately, in the modern world, the tiger is not really the real tiger standing there. Modern world, the tiger can be as simple as being unfriended on Facebook, or having, someone not responding to your message. Tiger can be of not being included in a dinner with friends. So it could be any of these things, which our brain does not know the difference. It is our thoughts which creates those emotions, tells the brain that, oh, this is a tiger, right? So brain is going to then go to work, shut the forebrain, go to the primitive brain to help us protect and make us really go into that fight or flight response. Now, during the fight or flight response, you're not going to sit there, learn a language or music, right? You're going to either run away, hide somewhere, or get angry or fight with the animal. That's what we would do. Exact same kind of chemical reactions happen in our body. So that stress hormones are having also a direct impact on our gut microbiome. So it is okay if we have acute short-term stress, which is good sometimes. Say, for example, getting on the stage and doing a speech. It is good to have a little bit of stress because then it helps us with our preparation. It helps us with, making sure the presentation is going well. But if we are in a state of chronic stress, the chronic stress hormones have got a direct impact on our brain, also direct impact on our microbiome. how it affects our microbiome is by changing even the pH of our gut, because we produce more acid when we are in a stressful situation. Acid changes the pH, but there are also stress hormones which changes the environment of microbiomes, which can eliminate some of the good bacteria sitting there protecting us, and might be more favorable for the pathological bacteria sitting there. Similarly, stress can reduce some of the protective chemicals in our brain, called BDNF and other neurotropic factors. So high levels of stress hormones causes those protective factors to go down. What happens afterwards is that certain areas of our brain which need to be functioning really well, like hippocampus, that's where, our new neurons in the brain is formed from hippocampus. So that area of the brain is actually suppressed by this stress. So it leads to depression. It also leads to destruction of the good bacteria that is going to make us good chemicals to feel good. So stress is having double effect. It's having an effect directly on our brain, and it is also having an indirect effect through, having damaging effects to the good microbiome in our gut. So hence, management of stress is very important, not just for our mental health, but also for our physical health.
Yeah, definitely. Completely agree. What are some of the chronic illnesses or even mental health illnesses that you see that come about as a result of bad gut health and what that you've seen in your clinical practice over the years?
Okay. Well, one of the issues is that we don't actually do gut microbiome analysis.
Mm,
Unfortunately, it is not under Medicare, and it will not be for a very long time. So it needs to have a cohort of people who are really interested in spending that a little bit of extra money to find your gut microbiome composition. So hence, it's very hard to say from directly from the clinical practice, but I can certainly say grossly from the diet and improvement in the diet and eating closer to nature, how anxiety disorders, how skin inflammatory disorders, irritable bowel syndrome is a classic example. And now new researchers are showing that autistic spectrum disorders has got a big link with a poor gut microbiome. In the past, I've been in psychiatry now for about 21, 22 years. And earlier on, the people who are coming with maybe autistic spectrum disorders were not looked into that much closely. But you are seeing a resurgence of, or the amount of number of people who are diagnosed with autistic spectrum disorders now, probably much more or in excess of the general population statistics from epidemiological studies in the past. So now researchers are saying that there is certainly less microbial diversity in people who suffer from autistic spectrum disorders, as well as other mental health disorders and neurological disorders, but particularly a type of Clostridium species, according to certain studies that I have read. I don't have any personal experience with them, but Clostridium species that are in excess in people in autistic spectrum disorder. But I can say this much though: a patient who's coming for autistic spectrum disorder, almost 9 out of 10 of them have got very rigid diet habits. They have got peculiarities about the texture of the food, and also very narrow variety of food that they would have. So if I take a diet history from them, they would probably have about 4 vegetables. Mostly it is corn, broccoli, then maybe carrot and peas.
yeah.
That's pretty much the most common vegetables that people talk about what they have. And processed foods like chicken nuggets, chicken schnitzels, sausages. So in autistic spectrum disorder patients, they do have this difficult relationship with food. They tend to eat the same food all over again, and which means that they're only having that much less variety of food, which means that their gut microbiome diversity is going to be a lot less. And it will be an interesting study if people are interested and I get the funding to do it. But yes.
Yeah, look, I think you're spot on there because I've seen it firsthand. How diet can impact some of these illnesses. I'd like to do a deeper dive into inflammation, because I think that inflammation is such a significant contributing factor to many chronic diseases, and in particular around the longevity of mental health, of good brain health, of cognition. We know that there's been some recent research that's come out of the UK around the detrimental impacts that alcohol, as an example, has on the grey and white matter of the brain, and how it can kill off cells. If you're eating a highly inflammatory diet, as an example, how can that impact our longevity and contribute to chronic disease, which in itself impacts longevity?
Okay. So when it comes to diet, what drives the inflammation? You would see people who are eating a reasonably healthy diet, maybe a small proportion of unhealthy food, still get away with a major, inflammatory response, and they tend to have a generally healthy kind of life. So we haven't really still worked out what's the proportion of food that it has to be to cause inflammation. But inflammation is a cascade of chemical reaction that happens in our body. It's not just localized in only our gut. The inflammation has got a major impact on our blood brain barrier. Our body has various ways of protecting our vulnerable, internal organs. And one of the way that our body protects our brain from the rest of, even the rest of our body, is through having a very healthy blood brain barrier. With the blood brain barrier, most of the chemicals that are there, it is there to, so skull is there to protect us from the physical damage, while blood brain barrier is there to protect us from the chemical damage. Often we have a very sturdy blood brain barrier, hence, most of these chemicals don't get to our brain. However, these toxic chemicals that get into our system through our leaky gut, what it does is that it weakens the tight junctions of this blood brain barrier, by which a lot of these chemicals are getting into our brain system. We still don't know, before glial cells in our brain were meant to be only those supporting cells. But now research is showing that they also play an important role in inflammation. See, inflammation is a good thing. If you have a cut in your hand, the inflammation need to be there to heal. But the problem is, when there is too much inflammation, it starts attacking all our body organ, and it loses the distinction between what is our body and what is an external agent. And that is where the problem happens. Once it starts attacking our insides of the blood vessels, then what happens? Increased atherosclerosis through plaques, which leads to cardiovascular diseases. There are certain types of diet and microbiome which can predispose us to cancers. Now they are finding that cancer has got their own microbiome, that it not just the gut microbiome that is getting in, and not just the microbiome which is sitting anywhere else. So inflammation has got lots of different pathways. It is meant to protect us. So as soon as a bacteria or virus or fungus comes into our body, it has got this ability of cellular immunity, where it comes and attacks them and digests them and take it away, and it produces antibodies to destroy these bacteria, which is a really good thing. But when these bacterial proteins, it is called lipopolysaccharides, or LPS, so these are highly inflammatory proteins that are getting into our system, and those polysaccharides causes this cascade of cytokine reaction, which really starts affecting all organs in our body. You can have cardiovascular diseases, you can have strokes, you can have cancer, you can have, high cholesterol levels, you can have renal failure. So you can have generalized problems. So inflammation is not a one simple thing. There is so many elements to it. And we're still working out what part of inflammation is triggered by what, because at the end of it, where it started gets kind of blurred, and we can see the end result of the inflammation. And targeting those areas by, say, the gut, where the inflammation can start from, is very important. And I think that's what is happening worldwide now.
Yeah, definitely. It's interesting because you mentioned earlier about maternal nutrition, and I did a an interview recently with a naturopath who has just released a book regarding exactly that. It's called Conversations with My Daughter, How to Have a Healthy Baby. And Dagmar was really awesome in doing a lot of research around how that sort of, I suppose, maternal health can impact the fetus, And I think that, you touched on that as well, that you're starting to see that come through in some of your clients as that, when you're doing their history health analysis there, that there are a number of contributing factors, and it might not just be what we're putting into our bodies now, but what our mums put into their bodies when they were carrying us as well. That kind of starts it all, right?
Yeah. See, when it comes to some of my, young mothers who are coming with anxiety disorders and or depression or other mental disorders, majority of them have got the best of the intention to try and, understand their children and provide what they want. But there is a saying in medicine, sometimes we have to be cruel to be kind. If a doctor is really worried about the pain the procedure is going to cause a patient, sometimes where we cannot use pain medications, we would end up losing the patient. So sometimes we have to go away from what people want to what people need. And a lot of the time, nutrition is a learned behavior as well. We look at what's being provided, it's not just about nutrition though. It is a whole lot of other factors. It is about when do we eat. It's what we are eating. Yes, it is important. When do we eat? Whom we are eating with? All that is important too. Having family dinners, having time with family, making sure that we are eating at the right time and not too late in the night. All that is so important for our body to function, because our body has got this clock, not just the clock for our sleep, but every cell of our body has got a clock gene in them. So, sometimes you can look at people who are doing shift work, and they tend to, even if they are eating the same kind of nutrition or diet, they tend to have more health problems compared to people who have got a regular routine and they're living in a circadian rhythm. And having nutrition, just what we eat, is only one part of the puzzle. We need to also bring in when we eat, whom we eat with. It's all about that recipe that I was talking about earlier. There was this saying that I read somewhere, and it makes perfect sense, and I use it again and again with my patients about health. Health is like a few balls that we are juggling in the air, and all of them need to stay in the air. And it's about 5 balls. One is our health. Second is our family. Third is our relationships. Fourth is our job, occupation. And fifth is our spiritual health. And this is a combination of these balls that we are juggling. And if everything is standing in the air, which means that we have got perfect harmony, only one of these balls is made of rubber and every other ball is made of glass. Can you guess which the rubber ball might be?
I don't know. Which one?
It's the work.
The work.
So even if
sense.
it falls, it will bounce back, while the others are made of glass. And hence, the attention need to be in caring for the others. And work, yes, it is important, but bringing all these elements together is what health is all about. I don't know whether this was the question you asked.
No, that's fine. I was just reflecting because I've just completed my own course in integrative nutrition, and one of the things we learn is exactly what you've just outlined there. Then we call it primary food and secondary food, right? And everyone thinks that primary food is everything that you put in your mouth. In actual fact, it's just what you've outlined there. It's our epigenetics. It's what's going on around us. It's our family. It's our work environment. It's our spiritual health. All of these things absolutely contribute, to how we consume food, how we absorb food, A case example is, don't eat when you're upset or stressed, because that has an impact on how your body actually absorbs the nutrients out of the food that you're eating. It doesn't process it in the same way, and you're not getting the same, nutrient absorption. So I think it's just such a fascinating area, and the human body is absolutely miraculous, and how it's this sort of finite ecosystem that is impacted by so many things that perhaps many of us don't necessarily consider on a regular basis. I mean, as you said, we've got 100 trillion microbes in our gut, which is just mind-blowing in itself, when you think about how that can impact our health if we're not fine-tuning that. And there is so much more research to be done around that. But can you outline how that impacts our genes? So from a genetic perspective, how do these microbes in our gut impact our genes?
When the Human Genome Project completed, and we figured out we have about somewhere between 22 to 25,000 genes, and we used to feel very far superior only until that they started studying paddy plant, where it has got about 50,000 to 100,000 genes sitting there. And then they started looking inside our gut, where there is 100 million different genes sitting there. Each gene is there to make the product of the gene is a protein, right? If our 25,000 genes are making proteins, these 100 million genes that are sitting in our gut are also making proteins. Now, how does it interact or interplay to cause this homeostasis of health? We don't know. So the genetics of that, we know that certain chemicals will turn on and turn off our genes. But it's not just the chemicals, it is also stress. It is also the amount of good sleep we get. It is the amount of sense of belonging, family. We are social animals. So there is a lot of factors that helps in maintaining the genes. So there are really two types of genes in our genomes. One is highly penetrant, disease causing or non disease causing genes. Say, for example, your eye color, my eye color, this is highly penetrant genes, regardless of that, that's coming from our genes, right? There are certain illnesses by highly penetrant genes. So if you have them, regardless of, you might still have the illness, you might be able to modify it through your lifestyle, but you will still have the illness because, unfortunately, that gene is there. But about 95% or more of our genes are not really completely dictating genes. They are the ones that can be turned off and turned on. Say, for example, young adults who decide to, who have major life events, they decide to use recreational drugs and eat a really poor diet. Totally, like all three of them are really going to have a major impact, massive impact on their brain's development. The late adolescence is the time where brain is deciding what to keep and what to throw away. It's a process called pruning. And during that time, if the young adults or young individuals are doing these things, it affects their brain trajectory forever. Even if they stop using drugs after 3 or 4 years of use, it changes their brain trajectory forever, because their relationship with stress and how they react to life events will be totally different, right? So genes are our friend, provided that we look after them through having a daily routine, manage our stress, sleep well, look after these gut microbiome, which then in turn will give us all these. Initially, when the research started, we thought we are 1:2, one human cell to two microbiome. Later on, it went to 1:10, and now they're saying it could even be 1:100, which means we are less human than more microbiome. And I want to say microbiome because all our studies at the moment is focused on bacteria. We don't know yet what the RK is doing, the viruses are doing, the fungi is doing. We don't know the combination and how it all interacts with each other. So we are literally a small, pretty much we are the culture medium for this bacterial or microbiome, literally, because we are the minority and they are the majority. And we cannot survive without them. If we nurture them well, hopefully they would be making the right kind of protein and chemicals that will lead to the right expression of our genes, which means that, the as long as we are living, we have a good quality of life. We're all going to die one day. That's certain. The day we were born, that is one certain thing for everybody. But
Absolutely.
dying is okay, but it should not be our fault, right?
Well, yeah, and I think also from my perspective, yes, we're all going to die inevitably, but it's about how do we die, and I don't know about you, but for me, I want to ensure that, I have great cognition, great mobility, right well, into my 80s, my 90s, and hopefully into my centenarian years, right? I want to be dancing on the tables when I'm 100. So I think it's, this mindset that society has had for so many years of the inevitability of dying, yes, or around aging in particular. The way we age is not necessarily something that we have to give up on. We don't have to give in to the concept of, yes, I'm going to end up with arthritis. Yes, I'm going to end up, not being able to move around as much. And yes, I'm not going to be able to do the things that I'm passionate about. No, you can keep doing all of those things as long as you continue to maintain your health in a proactive way. That being, maintaining good nutrition, looking after your gut health, maintaining mobility, doing exercise. All of these things contribute to living well longer. And I think this is the message that I'm really passionate about and trying to get out there. Yes, we are all going to die. That is absolutely going to, that is a known fact. But it's about how do we end up dying. You don't want a long suffering death because you have a chronic illness like cancer or something like that. It's about, okay, I'm dancing on the tables tonight and then I go to sleep tonight and then I might die, in my sleep. Okay, that's the way I would like to go out, not through a chronic illness or something like that. But look, I think, there's so much research out there, and you touched on supplementation there as well, and in terms of gut health. I mean, there's so much advice out there at the moment about, taking good probiotic as an example. From your perspective, what are your thoughts around supplementation for gut health and indeed for mental health?
From my own personal research, there are evidence to support both. There's one way that there are some studies to look at probiotic supplementation improving gut health. If the gut's primary, the baseline is at a place where the patient is having severe dysbiosis and they need the introduction of the probiotic supplements, yes, great. And they are looking at lots of different types of mycobacteria as to, in various specific conditions. Say, for example, they're looking at specific strains in obesity management, specific strains in management of irritable bowel. To me, though, until the research is a bit more widely spread and people are able to replicate that in many, many studies, some really basic techniques that are important for all of us. Every culture has got, fermented foods, and fermented foods
Mm,
are really rich sources of, this microorganisms which are there.
yep.
There are tempeh, kimchi, kombucha, sauerkraut. And, I come from an Indian background, and our common breakfast will be like, something called dosa and idli, which is like overnight fermentation of rice and lentils,
Mm,
and sprouts and all these beautiful, food are there for, if we look back into our ancestral, ways of eating. To
yep.
me, it is about being close to nature. Yes,
Mm,
for me, if you are having, say, for example, a course of antibiotic, go ahead, take a course of probiotic along with it, because the natural fermented products might not be enough to replace, the gut bacteria that you lose from antibiotics. However,
mm.
in general, if you are eating close to nature, it's so surprising. The moment I say having a high fiber diet, 9 out of 10 of my patients, the first thing spring to their mind is bread.
Is that right?
And, this is from all the diet information that I've collected from my patients. And
Mm,
I would really one day like to sit down and go through it and compare it with their clinical presentation. It would be a lovely study.
yeah.
But that's the understanding. Like, when it comes to breakfast, everybody wants a quick solution, something that is quick, out of the packet, off you go. And it only takes a little bit of discipline on a weekend to try and get your diet back to close to nature. So to me, the probiotic sources coming from the fermented foods, even the pickle foods and things like that you have, it's all highly fermented and it's really good for us, all in the right kind of, like, moderation. That would be the probiotic source. But also, when we are actually having a good variety of prebiotic foods, which is like, the fiber. We didn't talk much about fiber, but like, you and me have got bones to give us the structure, while plants have got fiber to give them the shape and structure.
Yeah.
In the past, when I was in med school, the fiber was only put to give the quantity to your fecal matter. That's all. It didn't have any
Hmm.
role. But now we realize that even though we don't use them, the microbes in our gut use the fiber, and they make so many beautiful chemicals and proteins for us, which is maintaining our health. So having a variety of fiber is very important. So I look at, like, diet. In my diet advice, I would say, let's look at a rainbow. Let's have a
Yeah.
rainbow in front of the
Exactly.
fridge and make this a game at home, and help your
Mm.
kids to, like, tick off the colors when you are having one color, and make sure the color comes from a different vegetable the next day. Say, for example, if you take a color orange, I would say one day it should come from carrot, next day from mandarin, third day from melon, fourth day it should come from sweet potato. So that kind of a variety you're looking for. So while you are in the supermarket, that's when you think about your diet, not at home. So when you're at supermarket, instead of buying three vegetables, big bags of them, you buy half a kilo of all the vegetables which are there. Include mushrooms, include beetroots, include pumpkin, include all those beautiful veggies that are sitting there. And if you don't know any new recipes, I would say add in one of the new vegetable into your normal recipe, and without it changing the taste, see how it goes. And slowly add on more and more veggies. If you don't know any other vegetable recipe, you could actually put it all in the oven with a little bit of olive oil and herbs and salt, and you can have roast veggies there then and there. It takes 5 minutes to chop it all up, and maybe 10-15 minutes in the oven. That's it. You've got a good variety. So variety is
Yeah.
the key, and you got to have about 30 different fibers is what they say, but as much variety as possible. And when I look at my patient cohort, I'm talking about just only a very small population group. I would say majority are having about 6 to 7, maximum 8 different fibers. And the plant, when you look at the proportion of plant food to animal food to processed food, it's only about 10 to 15% of their diet is coming from plant food,
Yeah.
while everything else is from processed food and animal food. And that
Mm.
combination is not conducive for health.
No, it certainly isn't. I completely agree with you, and I'm an absolute advocate of starting with food first, whole foods, preferably organic, where you can get it. Absolutely high fiber, nutrient rich diet for sure. Because for me, I think supplementation has its place. Absolutely, where we are deficient in certain nutrients, where our bodies can't absorb a particular nutrient from a food source as a result of our bio individuality, because we're all so different, right? So some of us can absorb certain nutrients differently to others. In terms of how gut health impacts mental health, how do we know whether it's our gut health that's impacting our mental health? Are there any tests or any tips that you can give people in terms of what they should be looking out for?
See, while we don't have any kind of particular test, one of the examples that in very clear evidence that we face is that when patients present to emergency department, especially in the elderly population, they present with almost like a demented picture, that they are losing the ability to say that what time it is and what day it is, and they're looking very confused. And you take a history, one of the first thing that you need to be eliminated is whether they are constipated, whether they are bunked up. And sometimes patients have not really opened their bowels for 2 weeks. Give them an enema, give them a bit of laxatives, keep them in hospital. And in 2 days' time, they're as clear as anything with their cognition. That is a direct evidence to say what's in your gut is affecting your brain and the clarity of your thinking, right?
Mm.
Second example is that people who suffer from anxiety disorders, a lot of them have got comorbid irritable bowel syndrome. And the irritable bowel syndrome was previously considered to be a functional gut disorder, but it's not really. More and more they are finding biological links with irritable bowel syndrome. But again, people who have got irritable bowel syndrome, I find personally a major link with dairy. I get my
Mm.
patients off dairy, and they report that they're not like having to run to toilet in shopping centers. They don't have to find where the toilet is as soon as they walk in somewhere. They can be comfortable to go out for a meal with family and not worry about soiling themselves, right?
Mm-hmm.
So that's another direct link of how their gut is impaired in a mental health condition. And obviously, if you are having such a condition, you are going to be so nervous. There is no way that you're going to be comfortable and peaceful when when your gut is telling something else, right?
No, absolutely. You're going to be in flight mode well and truly because you were looking for the exit to get to the toilet as
Absolutely.
quickly as
And I have
possible.
some of my patients who don't eat when they're outside. They want to take that
Mm,
element of uncertainty out, and hence they won't put anything in their mouth when they're out and about. And what a restricted life that is, if
it
their gut
is.
can be healed. And it's not always about you know just having poor diet. It is also sometimes the condition called like small intestinal bacterial overload, or SIBO. And sometimes such patients do need antibiotic treatment to get their pathological bacteria out before a new set of bacteria can colonize. So again, gastroenterologists will be faced with such patients, and I'm sure they're all doing a good job at it. So I won't actually claim to be an expert in that area, but certainly in my patient population, I would say avoiding dairy, avoiding gluten, going back to
Yeah.
nature, eating as many colors as possible, and having, say, 30 is ideal. I give them a cup measure, and sometimes when I ask them, like, how many cups of vegetables do you have? And they say three. And I would say, oh, that's good. You're having three. That's more than a lot of people. No, 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 that's three a week, you know.
Yeah.
So, so I would have to say, okay, let's try and make it three a day. And let's try
Exactly.
and make it that way, like, let's have a
Mhm.
bowl of fruits, a handful of nuts and seeds every day, and find ways of, if you don't like the texture, find ways of hiding the textures and mixing it all in somewhere. So all different ways, but the bottom line is increasing the variety, eating closer to nature, and managing your stress, having a daily routine, having good sleep, having good relationships. That's the equation for health.
Sounds like a beautiful life to
Mhm.
me. And also, from my perspective, it's about managing your environment as well. If you don't have the bad food in the cupboard at home, you're not going to eat it. You're less likely to eat it because you actually have to get in the car, go out and buy it, right? But if you don't buy it in the first place, you're not bringing it home. It's not there. Make sure you've only got good, healthy, whole food source options. All right. Well, look, this has been a fascinating conversation, Asha. And look, thank you so much for your time. I have one more question for you before I let you go. And I ask all of my podcast guests this question. What does it mean to you to live well longer?
To me, to be able to have purpose, to be able to be grateful, and having connection with my spiritual self is what I would want if I'm living longer. So my quality
Beautiful.
of life will be really aligned with these three goals.
Love it. Thank you so much.
No problem. Okay, thanks, Astra.
Thanks, Asha. Well, that's a wrap for today's podcast. Thank you for tuning in. And if you'd like to learn more about biohacking, go ahead and sign up on my website at www.biohack-her.com to get a free copy of my 5 top biohacks to get you kick-started. While you're there, you can also check out my blog page for more tips on biohacking. If you'd like to subscribe to this podcast, you can do so on Apple, Spotify, and Google Play. We'd love your support to keep this podcast going, and you can do so by leaving a review on your preferred podcast platform. And a reminder that information provided in this podcast does not constitute medical advice and is for educational purposes only. Please consult your preferred medical practitioner if you need support for your own health journey. Until next time, remember to live well longer.